Okay, so our case study today is about a 53-year-old female. She fell off her bike 6 months ago and immobilized her shoulder for 2 weeks, and then she was diagnosed with frozen shoulder. She's limited 10 degrees in external rotation and 95 degrees in shoulder flexion. Frozen shoulder is also referred to as adhesive capsulitis, which is chronic inflammation of the musculotendinosus or the synovial tissues. Signs and symptoms of this disorder is decreased shoulder active range of motion and passive range of motion, pain and inflammation. There's also 2 types. Primary is the most common kind. It's idiopathic and spontaneous. The second type is traumatic and more from immobilization, which pertains to our specific patient. Okay. All right, hello, my name is Toni. I'm a student physical therapist assistant at South University. Today we're going to be working on increasing that range of motion for shoulder flexion and for external rotation, as well as strengthening a little bit. Do you have a name that I can address you by?
Alex is fine.
All right, perfect, Alex. So if there's any pain or discomfort throughout this, just let me know and we can either modify it or stop that type of treatment, okay? Throughout this, I will have to be able to put my hands on you. Is that okay?
That's fine.
Okay, perfect. So what I'm going to do is have you lay down on your back. We're going to take a range of motion first.
Okay.
Okay. Okay. And I know that your right shoulder is the one that's bothering you. So what we're going to do is take range of motion for that, okay? Okay, so we're going to start on your lepridon and bring this up. Okay, and we're going to follow the ulnar styloid process. So then try to bring your arm, the top of your hand to the floor as far as you can, okay? Is that all you have?
Yeah.
Okay, that's fine. All right, so we have about 10 degrees of external rotation. Okay, so then, give me just a second, we'll put that down. And let me see if I can do it passively just a little bit more. Okay, let me know if you feel any pain or discomfort, and I'm just gonna push until I feel resistance. Just let me know if it's too far, okay? All right. And then end field is kind of empty, mostly because of muscle guarding. The next thing that we're gonna do is test your anterior delt, okay? So if you can just sit on the edge of the table. Okay, perfect. So then we'll bring this arm out. And if you can raise it up.
I really can't.
Okay, that's fine. So with gravity resisting you, you're only a 2. So we'll work on improving that as well, okay? The next thing that we're gonna do is something that's called an aptly scratch. So we're gonna test both sides for this one. We're trying to see if you're symmetrical. So I want you to do with your left side. You're going to bring your arm out to the side and then try to get it as far as you can in between your shoulder blades, okay? So we'll do it with your left side first. Okay, perfect. So you're right in between those shoulder blades, about midway through. And then can we try to do it with your right arm? Okay.
Can't get as far.
Yeah, you're just right there in the middle of the occipital, so that's fine. So we are a little asymmetrical. So you are positive for aptly scratch, but that's fine. We are gonna do like a functional skill activity to try to stretch that out a little bit, and then throughout the process we'll do some exercises to strengthen it. So just stay right there in that position. Okay, so this is a stretch strap. So what we're gonna do is you're gonna hold it with this hand underneath like this.
Okay.
And it's gonna go over your shoulder like that. So if you wanna bring this hand around, we'll just grab onto it. And then you'll hold this one. So then you'll pull the other, you might wanna hold it just a little higher, like a little bit up here. There you go. Okay, so then when you pull down on it, it can pull back for you. So you could start a little bit in the abduction side as well to try to pull it back. There you go. So then it'll help with that external rotation a little bit. Okay? Okay, so we'll use that to stretch it before we strengthen it. Okay, so you can hold it for about 10 to 30 seconds depending on how much you can tolerate. This is also an activity you can do at home too before you work out. Okay, how's that feel?
Feels pretty good.
Yeah? Okay, perfect. So let's see. Okay, so now that we've done some stretches, we're gonna move into an exercise, okay? So we're gonna have you lay back down. I'll take that. Okay, and we're gonna do a little bit of passive range of motion, so kind of like I did before. So this is just neutral for you. We're gonna go into passive range of motion and some external rotation. So like we did before when we were measuring the range of it, this will just be more of kind of to stretch it so you can try to get more external rotation, okay? So what we're gonna do is kind of push you into it, hold for just 5 seconds or so, and then bring it back, okay? Maybe 10 seconds if you can tolerate that, okay? Okay, I would have you do 3 sets of 10 reps, but just for demonstration purposes, we're just gonna do 5. Okay. Okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. One more. 1, 2, 3, 4, 5. Do you feel like 5 seconds was a long enough hold, or would you?
Yeah, I know where it kind of hurts.
Yeah. Okay, that's fine. So next treatment we can work on trying to hold it for in between 5 to 10 seconds to try to progress you to a little bit more, so we can get more of that external rotation. Okay.
Yeah.
The next thing I'm going to have you do, you can still stay on your back, and you can put your arm down. We're going to do anterior delt, so we're going to do shoulder flexion, since that's a limitation for you as well. You have 95, so it should be able to go out to just right about here. You're going to start from down here, still laying down, and you're going to bring it up. We are trying to strengthen it a little bit, so you'll do 3 sets of 10. We'll only do 5 reps for demonstration purposes, and then once you kind of get past this, since you are laying down, you will get a little bit of a stretch, so because gravity will be helping pull it down, so you can hold that for about 5 seconds as well, so you can strengthen as well as stretch a little. Okay? All right, so let's see. Just keep them straight out.
Okay.
All right, and then just bring it back as far as you can. This arm is your healthy one, so have it lead and this one follow, okay? Don't push into too much of pain, but do try to get that a little bit of a stretch, okay?
Okay.
All right about there?
Yeah.
Okay, so just hold for 5 seconds. 2, 3, 4, 5, and you can bring it back down. All right, perfect. You can do 4 more of those just for demonstration purposes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2 more. 1, 2, 3, 4, 5. Last one. 1, 2, 3, 4, 5. All right, perfect. How do you feel?
I'm tired.
All right, well, we only have 1 more exercise. I will have you lay on your side, but we do want this arm exposed. So if you're okay, if you can just switch sides.
Okay.
So this arm is on top, okay?
All right. Like this?
Yes, sir. Okay, perfect. So this one will be a little bit of a strengthening exercise. Since we've stretched it now, we've done a little passive range of motion. This will mostly be active range of motion as well as you're kind of fighting gravity, so it will be a little bit of strengthening as well. If you do this one at home, you don't want to do it every day because it is strengthening. the phase that you're in for frozen shoulder, you don't want to overactivate it and cause it more pain. So you want to stretch it a lot, but you don't want to strengthen it too much because it can regress. Okay. So what you're going to do right here, you're going to try to keep your shoulder in neutral right there, and you're just going to bring it up as far as you can. Okay.
Okay.
All right.
That's about it.
Okay, that's fine. You can bring it back down. We'll do 3 sets of 10 of this, and like I said, only like 3 times a week. For demonstration purposes, he's only going to do 5. That's 2, 3, 4, 5. All right, perfect. So then you can sit on the edge of the table. Okay. All right, so, we did most of the exercises for today. So I do just want to give you a little bit of education on where your shoulder is at. So, like I said before, we do want to stretch it. That's the most important thing. If you can stretch it every day, you can do that. We can do the athlete scratch run again with you can even do it with a towel if you'd like. So if you bring it up like this, then you can still pull down with this if you don't have a stretch strap at home or if you don't want to buy one. You can also do the passive range of motion, kind of like gravity pull it down a little bit if you'd like to do that. But stretching is something you can do every day. You can strengthen it a little bit, but like I said before, you don't want to do it too much. If you strengthen it too much or do too much work, if you're really eager to get it really strong again, you just have to be really mindful not to overwork it, because that can regress your progress as well. Okay?
Okay.
So there are 3 stretches here, 2 stretches. One is a little bit of strengthening, so you'll do that one, 3 times a week. Also, with your recovery, since we were talking about that a little bit as well, the duration can take for up to a year, and you could potentially not have full range of motion again. So you can keep working on it. Stretching it definitely helps, and strengthening it just for functional will help it as well. So these are your home exercise plans. We have 3, so we will have to go over them just to make sure that you understand them. I just want to make sure that you're doing them correctly. Okay? So the first one we have is a finger walk up the wall. So that helps with your flexion. We can do it right over here. So what you'll do is you can start, since you already have 9, you can have it right at shoulder height, and you'll just want to walk your fingers up. If you want to do it at the same time, you can, but really you only need it on your right side. And then just bring it up as high as you can. Let me see if you can do that. And then just go as far as you can. Don't push too much into or past pain.
Yeah, that's about it.
All right, that's fine. That's perfect. And then the other one is the pendulum. Okay. So what you'll do, if you want to have a table, you can. This one's not quite tall enough, but you can kind of lean over, and you can bend your knees a little bit to make sure, just that your back stays straight and you're not having bad body mechanics with it. And with your right arm, you can do circular motions, counterclockwise and clockwise. You can also go into flexion and extension. You can rock your body back and forth a little to assist with that, or if your shoulder feels comfortable enough, you can make it do it on its own. Okay. You can also go side to side to work with that. So this is mostly increasing a little bit of the laxity of the joint as well as lubricating it so it's not as painful to do things. Okay, so the third one is the external rotation side lying like we had done before. So we'll lay on your side like we did previously.
So on my right side?
Yeah, on your left side, so then your right side will be on top, okay?
Okay.
All right, perfect. So then just like we did before, you'll bring your arm up like that. You'll make sure that your elbow stays close to your side and you'll bring it up as far as you can. Okay. So like I said before, this one is strengthening. So you don't want to do it too many times, only like 3 times a week, okay? All right, perfect. Do you have any questions?
No.
Okay, perfect.
Do I get to go home now?
Yes, you can go home now.
Awesome.
You can rest and you can use any modalities you'd like.
Alrighty.
Okay, perfect. So then we'll bring this arm out, and if you can raise it up as best as you can. Okay, you're two. That's okay, it's okay.